If you've been noticing red, dry, irritated patches on your baby's skin and you're wondering if this could be eczema, then this video is for you. One of the hardest parts of being a parent is not knowing what's going on with your baby's health and wondering if what you're experiencing is something normal. So today I'm going to walk you through some of the most common signs of eczema, what it can look like, and when it may be time to even look a little bit deeper. But first thing I want you to know is that you're not overreacting by paying attention to your baby's skin. Parents are usually the first to notice when there's something off. And the earlier the support, the bigger difference it will make. So what exactly is eczema? Eczema, also called atopic dermatitis, is a condition where the skin barrier becomes more sensitive, dry, and inflamed. This can lead to redness, itching, irritation, dry or rough patches on the skin. And in babies, eczema often shows up a little bit different than most parents would expect. One of the biggest signs of eczema is persistent dry skin that doesn't seem to improve over time. You may notice rough patches, flaky areas, skin that no matter how much lotion you apply, it doesn't get better. And often parents will tell me that they keep putting on moisturizer, but the dry skin and patches keep coming back. And that is a very common sign that your child has eczema. Another common sign is redness and irritation. In babies, eczema often appears around the cheeks, along the mouth, on the arms, the legs, behind the knees, and even around the folds of the skin. It may come and go in flare-ups, which means some days that the skin may look calm and have some dryness, and other days it will be very red, very inflamed, and your child will be itching a lot more. It may come and go in flare-ups, which means some days that the skin may look calm and have some dryness, and other days it will be very red, very inflamed, and your child will be itching a lot more. One of the clearest signs of eczema is itching. Babies may rub their face against you, scratch their skin, seem very uncomfortable, and even have a lot of trouble sleeping because the irritation keeps waking them up. And even young babies who can't actually scratch may show some signs of discomfort. And this itching cycle is very important because scratching can irritate the skin even more and make the flare-ups worse to trigger the skin. For example, certain fabrics, soaps, detergents, and even their own saliva can irritate a baby's skin. Over time, you may begin to notice the patterns, and this is one of the most important things to do as a parent with a baby that has eczema, is to try to figure out what their triggers are so you can avoid them as much as possible. I want to mention something important. Not every rash is eczema. There are a lot of other different skin conditions that babies can experience, which is why it's really important to pay attention to how long this has been happening, where it appears, whether or not it's itchy, and how the skin responds over time. And if you're still unsure, it's very important that you get them evaluated by their pediatrician or a qualified healthcare provider to get an official diagnosis before starting any type of treatment. Another thing I often see is parents blaming themselves, wondering if they did something wrong or if it's their fault, and feeling a lot of guilt. But I want you to understand that eczema is something that's really common in children, and a lot of different factors contribute to it. So the most important thing is to not blame yourself, but to try to focus on learning how to support your baby's skin and their overall health in a more gentle and holistic way. This is where holistic support becomes so important, because eczema is not just about the skin itself. Also begin looking at inflammation, triggers, gut health, environmental irritants, and overall regulation in your child's body. This is exactly how I help parents understand what to do and how to treat their child's eczema at home safely with my program. so you can stop guessing and start understanding what your baby's body is trying to communicate. In the next video, I'm going to walk you through what commonly triggers baby's eczema and how you can start identifying your child's unique patterns. Because once you understand the triggers, everything starts to feel much more manageable. If this video helped you, make sure you like, subscribe, and continue along with the series where I will break down eczema in a simple but effective way.